Assalamu alaikum respected doctors. Welcome to my channel MBBS and BDS lectures. Today's the video number on our YouTube channel is 362. And today lecture is related to prosthodontics. And today's chapter is immediate denture. We will completely cover the whole chapter in this video. Now, there are 9 chapter outline. Number 1 is the introduction of immediate denture. Second is question, why we give immediate denture. Third is the definition of immediate denture, and fourth is the requirements of immediate denture, and fifth is the indications of immediate denture, and number 6 is the contraindications, and on the 7th number is the advantages of immediate denture, and then disadvantages, and last is the post insertion instructions. First we start from introduction. In introduction we will study what immediate mean. What is immediate mean? Immediate mean we give denture to patient immediately after extraction of natural tooth or teeth. Now come to the question, why we give immediate denture. The answer of this question is, why we give immediate denture. When patient teeth are lost, the function, aesthetic, all are lost. We give immediate denture for restoration of patient aesthetic, function, patient social well-being, and patient psychological well-being. Now come to the definition. How we define the immediate denture. Any removable dental processes fabricated for placement immediately following removal of natural tooth or teeth is called immediate denture. Now look at this diagram, before, after. Before, in upper jaw patient have few teeth, we extract the teeth, at the same time we give the denture. Look at after the upper denture, this is the immediate denture. Now come to the types of immediate denture. There are 2 types of immediate denture. Number 1 is conventional and second is interim. Number 1 is the conventional immediate denture. Now, conventional immediate denture, it acts as a long-term restoration. We give it for long-term restoration. Second is interim immediate denture. It acts as a short-term restoration, then we replace it by long-term restoration after 6 months. And now come to the requirements of immediate denture. The first requirement of immediate denture, it should be biocompatible with the tissue. Second, it restore masticatory efficacy. Third, it should preserve aesthetics. Fourth, it should preserve remaining tissue. And number 5th, it should harmonize the function. And number 6, it should harmonize the speech of patient. These are the requirements of immediate denture. Now come to the indications of immediate denture. We give immediate denture mainly in 3 conditions. First, if a tooth or teeth extraction is necessary, like in 3 conditions. Number 1, severe trauma. Number 2, extensive caries. And number 3, extensive periodontal disease with severe bone loss. In this condition, we give immediate denture just after removal of the tooth. Second is a patient is cooperative, in cooperative patient. Third, mentally sound patient, we give the immediate denture. Now come to the contraindications. Contraindication is the opposite of indication. Number 1, immediate denture is contraindicated in uncooperative patient. Number 2, mentally ill patient, because it cannot take care of patient. Third, poor general health. Patient with poor general health have many diseases like diabetes and other. And patient at high surgical risk, for example, bleeding disorder, CVS, because when we remove the multiple teeth in multiple extraction, the patient bleeding health is necessary. Now come to the advantages. What are the advantages of immediate denture? Number one, when we extract the teeth, at the same time we give denture, there will be edentulous period. Patient number two, maintain muscle tone. Number third, maintain occlusal vertical dimension. Number four, maintain facial height, because immediately we give the denture. There will be no changes in all these conditions. There will be no changes in the tongue size, and there will be preserved speech and function. And seven, there will be preserve patient social well-being, because at same time immediately we give the denture. Number eight, maintain patient psychological well-being, because if and the ninth is the least post-operative pain, because immediate denture heal the protect the extraction site. And number 10, it act as a bandage. How it acts as a bandage, immediate denture? Number one, to stop bleeding. Number two, to prevent food lodgement. These are the advantages. Now come to the disadvantages of immediate denture. Number one, anterior ridge undercut on labial surface interfere in impression making. This is the first disadvantage. Second is due to presence of remaining natural tooth, there will be incorrect centric relation and occlusal vertical dimension. Third, there will be difficulty in try-in stage when we check the immediate denture in patient mouth. Fourth, there will be more shear side time. Number fifth is the extra effort needed. Number six, immediate denture is expensive. And why? Because it needs frequent relining in order to meet the need for tissue changes. Therefore it is expensive. 7, it not provides stimulation to bone like natural teeth. There will be residual ridge resorption. Number 10th is the post insertion instruction. Now last heading is the post insertion instruction. Now post insertion instruction, first, during first 24 hours our goal is to maintain the clot. Therefore during first 24 hours we educate the patient, avoid hot liquid, avoid alcohol, avoid rinsing, do not remove denture during first 24 hours, because reinsertion will be difficult. Number 5, place ice packs for 20 minutes to decrease the swelling. And number 6, educate patient. Number 7, prescribe antibiotic and pain killer to the patient, and educate patient because patient think the pain is due to denture, they remove the denture. We should educate the patient the pain is due to extraction of tooth, not due to denture. Now after first 24 hours, number 1, ask patient for 4 point. 4 point is a strawberry red spot at canine eminence, lateral to tuberosity, posterior limit of denture. Number 2, check occlusion discrepancy after first 24 hours when patient come to you. Third, check denture retention. Number 4, teach patient. Teach patient mean how after 24 hours it insert and remove the denture. Now third, during first post insertion week, consult patient to wear denture for 7 days. Number 2, next, rinse the mouth 3 times a day to keep the extraction site clean. Now fourth, after 1 week, post insertion instruction after 1 week. Number 1, remove the suture. Number 2, after removal of suture, tell to patient remove the denture at night in order to give rest to the oral tissue. Third, now next after 1 week is the after 3 to 4 week. After 3 to 4 week, number 1, watch any patient complain. Number 2, replace tissue conditioner. Now and fifth number, after 6 months. After 6 months, what will be post insertion instruction? After 6 months, either reline the denture, mean reliner are used, or replace the denture. We have two options: either reline the denture or replace the denture. Now today our chapter is end. Now we have Telegram channels and WhatsApp groups for you people. If you are MBBS student, we have channel on Telegram by name first to final year MBBS lecture. And if you are BDS student, we have channel on Telegram by name first to final year BDS lecture, where we daily share notes, books, videos, etc. And we also have a WhatsApp group for first year BDS boys and girls separately. There everyone can share notes, books. And we have second BDS group for boys only, and also third BDS group for boys only. In future we will also create for girls also. Now all these channel and WhatsApp groups are all links are present in description of this video. You can join by clicking the link. Now if you like my video, press the like button and share this video with your friends. If you new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to you receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.